The chemo and the radiation can really affect your ability to have children. And so if you're a young, cancer survivor, I think even if you're not, if you're within childbearing age, I think it's really important to be aware of that. I mean, my personal story didn't have to do with chemo and radiation, but more with having had so much abdominal surgery, which most people with colon cancer have had, that, to make a really long story short, it's caused infertility for me. Emotionally, it can be really depressing. It can be it's really just a sad, some moments of overwhelming sense of loss. It was really difficult for me at the time that I found out, because I had just gotten married. We thought we were going to have a family, and it ended up causing a lot of problems for me in my marriage. And I'm divorced now. I'd say that's probably the hardest thing that I've had to deal with in my life, probably even more than cancer, to be honest. I was on large doses of prednisone, which is a cortisone medicine. It causes osteoporosis. It causes bone loss. And especially when I was on large doses of prednisone all through puberty. And now that I'm, 40, I was shocked to find out when I had a bone scan done that I was pre-osteopenia because of all the cortisone medicine I had been on 20, 30 years ago. And so I guess my advice to any patient going through high doses of cortisone treatment is to ask your doctor if there's an alternative, or to start taking calcium supplements at a really young age, because I didn't. Fortunately, I've exercised a lot, and the exercise really, plays a really important role in your bone health. But my advice would be to start taking calcium supplements, at a really young age, and see if maybe there's another drug alternative. My advice in dealing with doctors, I always make sure, if I can, have someone go with me. For me, when I'm in the doctor's office, there's a lot of anxiety around that, and your mind's racing, and I think it's just important to have another person there to listen and to absorb what's being said. And I always go to the doctor with a list of questions, and I kind of force them to spend time with me, because our managed care system doesn't really allow for that, but it's really important. And I've always gotten second opinions. I think that's also really important to feel like. I know a lot of people feel, intimidated, like maybe your doctor's word is the word, but I think it's really important. And if your doctor is hesitant or resistant for you getting a second opinion, to me that's really good information, because that's not, you should feel comfortable to be able to get a second opinion. And also, I've never hesitated to just go to a different doctor if I wasn't comfortable with my doctor. So I guess what I'm saying is sometimes doctors have egos that you have to deal with, and you can't let the ego get in the way of your health care. It's your life you're talking about here, and you can't. It's like their ego versus your life, and so you need to keep that in perspective. I'm Paula Ivy. I'm a 20-year colon cancer survivor.